Today I'm going to explain what to expect after a Profhilo treatment to your face. Typically, Profhilo is injected in the 5-point BAP technique, which involves 1 point here, 1 point there, another one here, and then one just below your chin, and then one to the side of your nose. These have been designed and implemented by IPSA, the manufacturers of Profhilo, to help get maximum effect with minimal downtime and minimal bruising. However, sometimes bruises can be expected, and sometimes your clinician may vary that pattern according to your needs, what suits your face best and your requirements. So Profhilo is unlike most other hyaluronic acids in the sense that there is no chemical cross-linking, and what that means is that rather than staying where we inject it, the hyaluronic acid, the Profhilo, will actually spread under the skin within various compartments of the skin and fat tissue and spread across the whole of your lower and mid face. This allows all of the skin there to be hydrated and benefit from the rejuvenation and regenerative effects of Profhilo. So that means that after your initial treatment, you may notice some swellings at the injection points, and these will settle down typically 24 to 48 hours after an injection. A few people may notice some mild redness or some itching over these points, but that again settles usually within 24 to 48 hours. It's important not to wash your face for 2 to 3 hours after the treatment. Your clinician will have cleaned your face thoroughly after the treatment, and you want those tiny injection points to close up before you start washing your face and applying topical skincare. So I recommend people essentially don't do anything to your face for the first 3 or 4 hours, and if you can, wait until the next morning before you wash your face normally and apply skincare normally. You should contact your clinician when there are adverse reactions, such as significant bruising or significant discoloration that you may think is bruising, but may be signs of other complications such as infection or vascular occlusion. These are incredibly unlikely with Profhilo, and since 2016, when I first started using Profhilo here in the UK, I have seen very few complications. In fact, the only adverse reaction I've seen is some redness across the whole of the face where perhaps there was a concern of a slight allergy, and in fact, which is again very unlikely but possible, but that patient since then has gone on to continue with Profhilo with no adverse effects. I think the most frequent adverse effect with Profhilo would be bruising. Our clinic, we use a V-beam laser to dissolve that bruising, so rather than putting up with a bruise for maybe a week or two, the laser will get rid of that bruise within just a couple of days. And that's a complementary treatment to our injectable patients. So if you are one of our patients and you've had a bruise after any injectable, please do call the clinic and we will fit you in to laser that bruise away. The manufacturer recommends no sauna, no swimming, no cold exposure to any facials for a few days afterwards. Personally, I think that once the injection port is closed, it's safe, and I think within 24 hours you can do anything you like. So there you go. Profhilo is an extremely well tolerated procedure. It is a bit stingy when you have the injection, but after that it settles down nicely. The expected journey is what I've explained. If you have anything other than that, please contact me. If you're one of our patients, please do call the clinic. And if you do like this video, please hit subscribe and like this video, and please do leave a comment below. Even if it's questions, I'll try to answer them online as well.